I've come from Pennsylvania in the United States. I'm an obstetrician gynecologist. Thank you for inviting us. Thank you. We are here as a team of doctors, nurses, and all kinds of logistical support. We are very excited to be part of this KATANI Hospital and see a lot of patients, try our best to help them out, also partner with the local doctors and hospital staff to learn from each other and hopefully do a lot of good work, good surgeries, and hopefully impact the patients' lives, their families and communities in a nice way, and make progress, all of us together. Thank you.
I'm from Pennsylvania also. My specialty is blood and cancer diseases, and we've been invited here to Kenyan Hospital, specifically KATANI Hospital, I apologize, in Kenya, specifically to treat breast cancer patients. Numbers from your own National Cancer Institute in Kenya show that over 40,000 women a year get breast cancer. That's 1 out of every 11. Without any therapy, they will all die. We will be able to offer some therapy starting right here, where we can treat at least around 75 to 76% of the patients, and they will have somewhere between a 65 to 75% response, which means it gets better. There will be some that we won't be able to treat, but that's all part of the program. We want to go through separate phases and advanced treatments over time. So we're very excited to be able to offer breast cancer therapy to the women in Kenya.
I know you talked about cancer. We have breast cancer in men. And,
yes.
Could you also talk about that?
Well, breast cancer in men is much more rare. Prostate cancer in men is much higher, but that's a different type of tumor. But yes, actually, these hormonal drugs that we can use in women can be used in men as well as breast cancer. It's a little different, but I've done that many times.
So are men also allowed to be part of this?
Oh yes, absolutely. It's just that, you know, for every woman, for every 100 women that we see with breast cancer, there may be less than 1 man per 100. So it's much less common. So this is really a disease of women. You know, like I said, 1 out of 11 women. Yeah.
I'm Arthur. I'm also from Pennsylvania in the United States, and we live fairly close to Philadelphia, which you may know as one of the big cities. I'm a plastic surgeon, and I'm one of the founders of Operation Medical, which we started back in 2013 so that we could come and do camps like this all parts of the world. So on these trips, I tend to take care of a lot of patients with scars, keloid scars, burn scars that limit their movement and their ability to function. We also will do cleft lip surgery, take off small tumors and lesions of that sort, and in some cases we'll deal with other types of wounds that are chronic over time.
Is it the first time you're coming to Kenya to do this?
First time in Kenya. We were in Rwanda a few years ago to do a mission in Kigali. But this is our first time in Kenya to do this. We go to India almost every year and have our biggest mission group there with the bigger hospitals. And we've also had a chance to go to Nepal, and I've spent a couple of missions in the Philippines as well.
So how many patients have you taken so far since you started this mission?
I've been on about 12 mission trips so far, and the group also would go to Haiti, which is an island in the Caribbean. So there are many more missions there. And there have been a few missions that Operation Medical has done that I have not been able to attend. So we're probably close to 20 or more missions altogether for Operation Medical over the years.
So at each mission trip, we operate between 200 and 300 patients, and they include all types of surgeries: plastic surgery, gynecological surgery, general surgery, ENT surgery. So this time, our surgical specialty is only two specialties, plastic and obstetrics gynecology, but at other mission trips, we've been able to offer a lot more variety of surgeries.
I'm from Wisconsin. Nearby cities like Milwaukee and Chicago, My job during the trip is to help facilitate the surgeons to make sure that the patients are both safe for surgery and able to recover locally. So prior to surgery, I would make sure that they are in proper health in order to undergo the surgery and any risks that might be associated with that. During the surgery, we make sure that they're comfortable and sleeping so they don't remember a potentially painful surgery. And then afterwards, recovering them, again, making sure that there's no complications or side effects that we need to worry about, and that they're able to go home safely and recover well in the community.
I'm Modesta Makani Besander. I'm the CEO of KATANI Hospital. I'm so happy to have this operation team here. I've been working on this team to come here for many months, and now they are here. I'm happy. This team brings a lot to KATANI Hospital. We're in need of the services that they are going to provide to the community, to the patients. These services are expensive otherwise to the people in the area. They're not able to afford. I have patients who come in with children who are severely sick because they have not been able to afford this before. So there's hope for them. There's hope for these children. They can now afford to get treatment that they need. So I'm just thankful. But I also know that you guys of the media have been very instrumental in passing the message along. I want to thank you for that. And thank you for being here today, because through passing the message around, we are empowering the parents of these children who otherwise would either die or will stay back in their homes and not get the treatment that they need. But now that the team is here, they will be helped. But I also know that the team has promised that they will be coming more frequently to Kenya to provide these services. The reason why we have limited services for this round is because it's their first time and we hadn't done it before, so we said we'll split it. So next time when they come, we'll have more services coming to KATANI. But I want to thank them all for just taking the time to come. We don't take it for granted, because this is help that has been needed. This is help that will save a lot of families. This is help that will help a lot of children to be able to live a normal life. So as we go on taking care of these patients, I just pray that God will be in our midst, that everything will be well. But I also want to thank the team and assure them that they'll be well taken care of, and if they need anything, we'll be here to help them. So we are ready. We're ready for the patients. Patients have come in from far and wide. They've come in, some patients have come in from Mombasa. Some patients have come in from Western. Some patients have come in from different parts of the country. Patients who've heard about this camp and who know that if they don't come to KATANI, they may not get this care that is available. So as you spread the word, guys in the media, let even more people know that there's hope. And even if they're not helped during this camp, next time at this camp we'll be here again, they can come for help. So I just want to thank you for coming, everyone, each one of you. But I also want to thank my team above all for organizing this. I can't forget to mention Cheryl. Cheryl has been very instrumental in just putting everything together, calling for Zoom meetings and being very persistent. And I think without her, we probably would not have made it. So I just want to say thank you so much.
Yeah.
And
For how long will the team be around?
the team is here until Friday. So the team is going to be here until Friday, and then after that, they'll go and do other things, but they'll be coming back, hopefully sometime soon this year.
So, do you think our Kenyan government is doing enough to release these cases, and do you know what you think should be done?
Well, I think we need a lot of training. We need a lot of training for the doctors to be able to, do this kind of surgeries or provide these kind of services to patients. I'm not sure that the government is training enough physicians, or if they are, they're not retaining them. So a lot of physicians that are being trained are actually going out of the country looking for better places. But I think if we can maintain or if we can keep physicians here after training, they can be able to provide the services through training. Yeah.
Yes, you can comment about that.
Okay. So with the cleft lip and cleft palate,